Insulin is a hormone made by the pancreas. It helps glucose from food to enter into cells to be used as energy. People with type 1 diabetes don't make insulin, and therefore it's necessary to take insulin. For type 2 diabetes, the insulin we make cannot work effectively and/or not enough is produced. Whatever the type of diabetes, because the glucose cannot get into cells properly, it begins to build up in the blood and leads to hyperglycemia. For all types of diabetes, the goal is to normalize blood sugar levels. For some people, this will mean they will need to take insulin. Today, the most common way to administer insulin is by injection. It can be done by using disposable or reusable pens or syringes. Short and rapid-acting insulins are the only insulins that can be used in a pump. Pens and other injection devices must never be shared or used by more than one person. Wherever possible before injecting insulin, wash your hands with soap and water. If using a pen, then the needle must be changed each time. If using a syringe, then a new syringe and needle should be used each time. A used needle is less sharp and no longer sterile, and can make injections more painful and less accurate in terms of insulin administered. Remember to change the injection site regularly to prevent the formation of lumpy skin, also known as lipohypertrophy. This is where little balls of fat accumulate under the skin and can prevent insulin from being absorbed correctly. The needle is inserted at a 90-degree angle. Keep the needle in place and inject the selected dose slowly, and hold 5 to 10 seconds to prevent any insulin from escaping out. Make sure to follow the instructions about this that come with your device and those of your healthcare team. Never inject through clothing. Once the needle has been removed, do not massage at the injection site, as it can affect the speed at which the insulin is absorbed. Ensure that the needle is safely disposed of after use. Warning: in general, your insulin and/or insulin device should be kept away from direct heat or light when in use. Extreme temperatures could alter its effectiveness. Be sure to always follow the instructions and recommendations about storage that come with your insulin, as well as those from your healthcare team. Many different elements can affect your blood sugar levels, such as diet, physical activity, emotions, hormones, or illness. No single dose fits everyone. How much insulin you need depends on many factors, such as your weight, type of diabetes, activity levels, and the amount of carbohydrates you eat. Keep a record of the number of units of insulin you're taking. Regular testing of your blood sugar will help you and your healthcare team know if you're taking the appropriate dose to reach your glycemic target. To assess your basal insulin dose, you'll need to test your fasting sugar levels before breakfast and sometimes before other meals as instructed by your diabetes team. These results are related to the role of basal, which is also known as background insulin. Your blood sugar level after a meal is related to the amount of carbohydrates in the meal, and this blood sugar spike is managed by your body's insulin. But sometimes mealtime insulin is needed if you have type 2 diabetes, just before or shortly after your meal. A blood test can be used to check the average level of sugar in your blood over the preceding 3 months. This is known as your HbA1c, which will give a good indication of how well your diabetes is being controlled. Over a long period of time, high glucose levels in our blood can seriously damage our heart and cardiovascular system, our eyes, our kidneys, and our nerves, especially in the feet. Always carry glucose, your glucose meter, and your insulin device to adapt to different situations as they happen. For people with diabetes who require insulin, it helps them keep their blood sugar and diabetes under control so they can live their lives to the fullest.